I'm back. Aren't you guys just feeling more and more patriotic as the day goes on? I know I am. So we have our next policy lightning round. So please take your seat, pull out your phone if you're doing your polling through your phone. If you do not have a phone or you need a clicker, you just raise your hand. We can grab you one of those. But this next policy lightning round was actually one of the ones you guys said was one of the things keeping you up at night. Healthcare. What are we going to do about it? What does it look like? How has it changed since COVID happened? So for our first polling question, we have you had a telehealth appointment in the past year? For option 1, it is yes. For 2, it is no. For 3, it is unsure. Maybe you aren't sure what a telehealth appointment is. So 1, yes, 2, no, 3, unsure. And we asked you in your pre-survey, have you been impacted by having access to healthcare? And what we saw is that generally yes, that some people had a really hard time during COVID, that some folks live in parts of America where you actually have to travel to different counties in order to get a specialist. For some of you, we saw that what you need is to start thinking about the future and rising prescription costs and what that looks like and what that means. As you answer this question, and as we soon will turn to each other to talk, keep thinking not only about how you've been impacted right now and in the last year, but also potentially how your family or community has. Some folks mentioned they had waited over 8 hours for an ER visit. One person mentioned that they've had really mixed experience with telehealth, sometimes getting the answers they needed, sometimes not. So for have we used telehealth, the majority of people, 64%, said yes, 35% said no, and 1% were wondering, what is this? So I'm going to reintroduce the president of the Bipartisan Policy Center, Jason Gramey, so we can learn a little bit more about it.
Anybody notice the pants?
Thank you, thank you.
All right, well, that last session was some big stuff, and healthcare is big policy, and we are honing in on this rather new aspect of healthcare, which is, of course, the ability to see a doctor without going to a doctor's office. This became an imperative during the pandemic, right? So I think many of us, 2/3 of us, had some experience with a virtual or Zoom doctor's appointment, and now there's some really big questions. So, some people think the appointments were actually better. A lot of people think they were better than nothing. And there are a lot of places in the country where your option is nothing. But now we have to decide about what to do going forwards. The reason that telehealth exploded is that the government declared a public health emergency and decided for the first time that Medicaid and Medicare were going to pay doctors for virtual visits, right? If that hadn't happened, we would not have had an explosion of telehealth. That emergency declaration is now running out, and so now there's a big question. What does Congress do? Do we continue the process of just, paying as we go? Do they change the payment rates? Do they change the access? These are some pretty important questions, but this is one of the more optimistic aspects of our discussion. Because in the US, we pay far more for healthcare than any other country in the world, and we get kind of meh outcomes. And there's not been a lot of ideas that could really change the curve of that. And I think people think that telehealth actually might be able to provide that kind of lower cost, quality care in a lot of situations that would make life better for a lot of folks. So to give you the details, my dear friend and colleague, Julia Harris, she is our telehealth expert, has been studying these issues, and she is not nervous at all. Thank you.
Thanks, Jason. All right. As Jason was mentioning, telehealth use exploded in 2020 due to all the changes that Congress, the administration, state governments, and private payers made to policy. And it looks like many of you benefited from some of those flexibilities that happened. Many of those new flexibilities are tied to the federal public health emergency for COVID-19 and are likely to run out unless something is done. And so some of the most significant changes that Medicare made were to temporarily allow people, no matter where in the country they lived or what types of conditions they had, to have video visits and phone visits with their providers from home, and that was very new. And they also, like Jason mentioned, began paying the same for to providers for if they saw their patients over the phone or over video, the same as if they physically went into an office. So two very big policy changes that we should keep in mind as we think about what the future holds. So what happened to telehealth use during the pandemic? Well, there we go. So at BPC, we often look at things through the lens of Medicare. They're a leader in the insurer space, and so we did our own Medicare data analysis. And we found that overall telehealth use for Medicare beneficiaries by 2021 was almost 40 times higher than it was before the pandemic in 2019. And interestingly, those with disabilities, end-stage renal disease, those who were dually eligible for both Medicare and Medicaid were much more likely to use telehealth services. And so it's important because it indicates that the telehealth flexibilities were creating easier pathways for people who struggle with mobility, who are sicker, and who likely face many more barriers to accessing care in person. We also found that people in urban areas use telehealth at much higher rates than their rural counterparts. Essentially, the further that you lived from an urban center, the less likely you were to get a telehealth visit. And that suggests that access to high-speed internet is still a big problem in rural America. And also minorities were more likely to use telehealth than white non-Hispanics. And it may be that people of color more often experience barriers to in-person care, such as lack of transportation or not having the kind of jobs that give you time off easily. We also found that a lot of telehealth during the pandemic was for primary care visits. And so this is interesting because the way that the policy was before the pandemic was to think about it in terms of a way for people in rural America to access specialty care. And what we saw when all the policy constraints were lifted was actually the majority of people are using it to just get a visit with their primary care provider. And at this point, primary care is the largest share of all telehealth visits that happen. We also observed a high reliance on telehealth for new mental health and behavioral health, substance use appointments, and over 1/3 of Americans are currently in a place where there's a mental health professional shortage. And so access to telehealth can address that lack of behavioral health providers. It also gives people who are worried about the stigma associated with those visits a way to get care, especially in tight-knit rural communities. And during the pandemic, many Medicare beneficiaries were newly accessing treatment because of telehealth. Lastly, there are a few red flags that I just want to note, which, people are concerned about what telehealth access will do to the cost for healthcare. Because of the accessibility of the benefit, it tends to be that you access more of it. And also another red flag is we do see that some providers may be taking advantage of looser pandemic rules to overprescribe medications. And so in the news lately, the DEA has announced that they're investigating several mental health startups for overprescribing. And so overall, we think telehealth has become and will remain an integral part of healthcare delivery, but we may need a few more guardrails than what we have today to protect the benefit. And so we recommend that Congress and the Biden administration do extend the current flexibilities for an additional 2 years so that we can keep studying what is the impact going to be on healthcare costs and access to care and the quality of care. So with that, I'm going to turn it back over.
Sounds good. Thank you so much, Julia. All right. Now it's up to you, audience. Do we have bipartisan thoughts on telehealth? So we're going to divide the audience into two. If you're on the right side of the American flag, you're Group A. Can Group A raise your hand for me? And if you're on the left side of the, left for me, side of the American flag, can you guys raise your hand? You're Group B. So we're going to give you a couple minutes to talk with the people around you. We have facilitators around the room. Facilitators, if you could raise your hand, who will be listening in. We also have a bunch of people online who will be. But if you can discuss the following. So Group A, discuss with those around you some of the potential disadvantages for extending this flexibility on telehealth if we let some of the COVID precautions and rules that were changed get extended. Group B, can you guys please discuss with those around you potential benefits or advantages if we allow telehealth to continue to expand? So I'm going to give you 4 minutes and go. All right, you've got about a minute left. So if somebody around you hasn't talked yet, it's their turn. I give you permission to call them out. Alrighty, 5, 4, 3, 2, 1. Time's up. Lightning round. Let's see what you guys had to say. I saw a lot of really intense, great conversations. So I'm going to start with Group A for the disadvantages. So it sounds like people want more focus on insurance. You can't get your vitals or your blood drawn over the internet. It's probably a good thing. We want to be in person. Some people prefer that. That for older patients, it could potentially be a barrier. That some people said there's no disadvantages. This is only good. So that's exciting. So let's hop over to the extending. What would be the potential advantages? So much like we saw on the other side, actually, some folks think it's easier for people who are older, maybe who can't drive, or then they could have family around them for some of their appointments. It allows for quicker access to doctors. Some people said they are more comfortable being able to meet online, that you may be able to have more access to specialists. And that it helps filter out those who really do need services so that they can get more in-person attention. So it definitely seems like, there's things to consider, but that in general, we see that, a lot of us recognize that thinking about this and making sure we're just not letting it completely expire makes sense to do. So we have one last telehealth poll question for you guys. So whip out those phones and those remotes, and then we'll be headed into the final panel. But do you think Congress should work to extend flexibility for telehealth? Option 1 is yes, and I'd be willing to pay more for this flexibility. Option 2 is yes, but not with any additional costs. Option 3 is no, I don't think we should extend it. Option 4 is I don't have an opinion, I'm still figuring it out. Option 4 probably also means you'd love to join us in the Kirby Auditorium after this for you to be able to hear more from Julia and ask her questions. While you're answering, I also wanted to say the Bipartisan Policy Center actually has a really fantastic report on this that I got to preview in order to get ready for this, coming out tomorrow. So if you aren't already subscribed to their newsletter or on their website, be looking for that. They did extensive research on what did this actually teach us by having this much access. So highly recommend it. The surveys are coming in. Online, people are commenting away. So once again, 1 is yes, and I'm willing to pay more. 2, yes, without any additional cost. I'm proud of people who are willing to pay more. I just want to say that. I don't know what I would have chosen. So survey says that over 50% of us do want this, but we would like it to kind of stay at the same level like it was in the pandemic. 24% of us think yes, and you would be willing to pay more for the convenience, I'm assuming, or just the additional benefits it adds. 6% of us think no, let's not extend it, let's go back to how it was. And 5% are thinking, I still don't know my opinion, I'm gonna download that report tomorrow when it comes out. I think that's all of that 5% we're thinking. So thank you guys so much. We're gonna hop into the next panel, and I will see you soon.